Hello, hello.
Hello, 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 hello. Big news today.
I
Well,
know.
big
What a
big
gift.
news this week, even.
Big news this week. And we get to connect and chat about it.
Yeah, which is great. Which is
Do you
great
want to
because I think
dive?
it's a big deal for all of us, isn't it?
It definitely is. And we figured it was worth us having a little chat about it and mark this milestone, celebrate the
Yeah.
milestone.
I mean, I feel like proper history is being made. It's epic. It's been such a long time coming. So I love that we're taking a bit of time to just mark that moment.
Yeah, absolutely. Do you want to break the news?
Well, PCOS is now PMOS.
Woohoo.
And it's just fantastic. It's fantastic. And I know there's been loads of criticism. I mean, I'll step back a moment for anyone who isn't aware of PCOS or hasn't come across it. That means polycystic ovarian. It stands for polycystic ovarian syndrome, and it's been such a poorly named condition for what is also a poorly understood condition, actually. And so finally, after lots of campaigning and lots of involvement from so many different organizations, and do you know what? And also some pretty impressive advocacy from charity, the PCOS charities. I know Verity's done so much work in kind of driving this forward and loads of worldwide organizations as well. And we've now got PMOS, which is Polyendocrine Metabolic Ovarian Syndrome.
Yes.
And it's just amazing. And you know what? It was never, and I know even already there's been critics of, the name and actually, can you ever get it right and all of that. And I just think, well, yes, you can never get it right, or you can always do better. But actually, this is so much more reflective of the condition that we see on the shop floor and that women report. So yeah, this is just a really fantastic change.
Yay. And I saw a little bit of a shortcut popping up a lot on social media around you know, PCOS or PMOS, as we'll be calling it moving forward, is the simplified version is it's about hormones and metabolism, right? Not just about cyst. Would you say that that's a fair kind of like,
Yeah, and to be honest, it's not even about cysts. Cysts are actually the downstream, and they're not even cysts because actually that's been the main error in the way that we've described it is that we've talked about these ovarian cysts, but actually they're follicles, or arrested follicles, which are the little sacs which contain the eggs. So they're not cysts in the traditional sense when we talk about an abnormal cyst. So I think that's a really important variation. And women have always, the number of times I've seen women in clinic who will come in really frightened, understandably, because they've been told they've got loads of cysts on their ovaries. And what are we going to do about them? When actually, like you say, the bigger picture is the fact that it's the hormonal layer of this, and it's multiple hormones, not just your sort of your male type hormones and your female hormones. There's lots of different hormones which are affected, and that's the metabolic layer because you've got insulin resistance that plays into it, and it's highlighting the layer of risk for the future as well, because women with PMOS have a much higher risk of having cardiovascular sort of conditions later on in life. And so being able to support them appropriately now is so super important. And so, yeah, I just think, this is just a landmark because it's not just about, I think there's been wrong information shared on both sides. Patients haven't known what, haven't had a name, haven't had the words to be able to use to advocate for themselves. And doctors actually also, through the poor naming, have not had the knowledge to say, actually, this is more than just, oh, your periods are irregular, therefore you'll struggle with fertility. That's fine. Come back and see us when you're trying to get pregnant. it's sort of saying that actually, no, this affects every single day and the long term, and we need to take it seriously.
Yeah,
How
it's
has,
an
sorry, go on.
no, you go on.
No, I was just going to ask you because obviously in my world, PCOS has been, front and center for a very long time. It's just thinking, how has PCOS kind of existed in your world? Obviously through period reality, I'm sure it's come up, but has it been in any other area?
Um, yeah, well, and definitely through stories that people share that it's just so unpredictable, right? And because you're part of a medical system and a space that is so unsure about quote unquote what to do with you or what to do with your symptoms, it also makes you question your own body, right? And it's like, so
Mm,
clearly I don't know what's going on with my body. Clearly, I don't know what's happening to it. I don't, so I think there is a lot of confusion on both sides.
yeah,
Right. And I think we often obviously you'd hope that you can turn to your doctor to be reassured as well, even when something is wrong, of like, we've got this and we'll look at it in a holistic way. And I think, we like to talk about system-wide things anyway, but I think to move this conversation away from it wasn't just reproductive,
mm,
and it's actually that system wide where we look at, you just mentioned like hormone, obviously your hormones, but all kinds of hormones, insulin resistance, your metabolism, inflammation, fertility, like all of these are really important
absolutely.
themes. And by naming that, I think, there's an opportunity to look at all of them together and hopefully remove some of that confusion, because I definitely say that feeling of not being in control and not understanding or knowing what's going on in your body is been the main thing,
Mm,
and that's been coming up outside of the physical discomfort or the struggles that people have from a fertility perspective. Because
yeah,
even with like things like cycle tracking, like the tools and the resources that we offer to provide people with some of those insights about their bodies don't always work for people with PCOS,
yes,
right?
yeah,
Because it's
exactly.
irregular, or because it's unpredictable. So I think
Yeah,
this is such a great pathway to even just have these conversations, right?
yeah, yeah, completely. And the other thing I just want to highlight actually that comes to mind, actually I was posting about it this morning, is the fact that the one piece that we don't talk about is the ethnic variation in presentation, not just presentation of PCOS, but the existence of PCOS. So it's far, far more prevalent in South Asian women, and it's even more undiagnosed in South Asian women. So they will struggle for years and years, and we
Mm.
already know that they are, besides PMOS. I have to like get my flip on saying it, but besides PMOS, women, South Asian women are at high risk of diabetes and heart disease anyway, and add PMOS to that, they're at even higher risk. And yet we don't screen separately for it. So we don't have
Mm.
specific criteria for screening them when we know that there's actually research to show that it's nearly double or exists in nearly double the women in some South Asian women versus women of European descent. So there's really important layers there that this gives us an opportunity to kind of now target, because when you rename something, you can look at it with a totally different lens. So
Yeah.
recognizing that this is now a metabolic condition then kind of creates those links and relationships. So I'm really hopeful. So I know NICE are going to publish a guideline on PMOS, and I'm really hopeful that they're going to bring in advice about how you screen for it in other populations. The other thing that's really interesting is actually Eastern Asian populations. So Chinese actually present differently again, and so there's a chance that it's underdiagnosed because they're more likely to have less hirsutism, which is excess hair, and excess. So we talk about excess androgens, so male type hormones. So the Eastern Asian populations are less likely to have that. So they will have that. So you're more likely to say, no, you don't have PMOS, when actually they do. But actually, so there's been a campaign to reduce the actual levels of that you need, of levels of testosterone that you need in order to make that diagnosis in those populations. So there's so much nuance that's so important to address. And I think the renaming really brings all of those things to the table in a way that, PCOS just didn't. So I
Yeah,
think
I
this is
appreciate you
really
bringing that
great.
up. Yeah, no, I think that's a really important point that across women's health and across healthcare, so much work needs to be done, right? In how different
Yeah.
things show up for different people from different backgrounds, different
Backgrounds.
cultures, different races. So I think that's a really important thing to mention. And just based on what you were just saying, I think in terms of starting this conversation, it also gives women agency, right? Because now maybe by using different words, they can do their own bit of research, they can build their
Yeah.
language that
Yeah.
they can then take to their doctors, right? So it's really
Exactly.
that bit of empowerment as well. I think, just helping for sure this will improve awareness, hopefully reduce misunderstanding, and to your point, like encourage earlier diagnosis and support more comprehensive care and research. So I think that's a nice summary.
Yeah.
Anything you
No,
want to
I
add?
think,
Do you want to end us on
yeah.
a mic drop moment?
I mean, I don't know that I have micro drop moments, but I mean, this is epic.
It's
And
epic.
I'm so excited for what's ahead because it's just a new era for such a
Amazing.
misunderstood, misdiagnosed condition. So yeah,
Incredible.
let's see
And as
what
always, we'd love to hear your stories as well. So if you have any stories or
please share.
experiences, please share them because that'll
Yeah,
be so much more powerful than me and Kat yapping about it
I mean,
endlessly. So please do get in touch.
absolutely.
We'll see you soon.
See you soon.
If you would like to reach out to the Not Designed for the Grind team or want to tell us your story, we'd love to hear from you. You can email us at podcast@periodreality.org or follow us on Instagram at periodrealityofficial. You can also connect with us directly on Instagram at the.delphi.clinic and at Marlou Cornelissen, or find us on LinkedIn under Dr. Katarina Bambang and Marlou Cornelissen. If you'd like more resources, show notes and updates, visit periodreality.org/podcast. If someone came to mind while you were listening, send them this episode. And if you believe in what we're building, the simplest way to support us is to follow the show on Spotify or subscribe on Apple Podcasts. Ratings and reviews really do help more people find us, and 5-star reviews go a long way. A big thank you to all of you listeners, and please remember, the only thing that is true is what is true for you. Not Designed for the Grind is a podcast by Period Reality. The show is produced by Isabella Lindahl, created and hosted by Dr. Katarina Bambang and myself, Marlou Cornelissen. Audio editing and mixing by Delilah Odima, and our visual branding is developed by Millie Mensa. A special thank you to Favor Asueleman and the incredible team at Period Reality. We'll see you next time.